Good morning. Today I'm here with Prof. Cristabel Fagela-Tiangco, an UPDEPP professor who holds a master's degree in clinical psychology and a candidate for the doctorate degree in educational psychology. Good morning, ma'am. Ma'am, today I'm very curious about this topic and I want to learn a lot from it. It's labeling people with psychological disorder. It's very common nowadays, especially the depression. But people always misunderstand or they're not that aware. We are not that aware of this case, and we sometimes consider a grief or sadness. We say we're depressed, but in the first place, ma'am, what is depression?
Okay. Everyone feels sad now and then, and we label that as being depressed. However, clinical depression is different. When we diagnose someone as having clinical depression, there are particular symptoms that are present for a particular time frame. If you look at the DSM type or the Diagnostic and Statistical Manual for Mental Disorders, it states there that 5 symptoms out of those listed are present within a 2-week period, and the person might be diagnosed then with depression. So the usual symptoms would be feelings of sadness or a depressed mood most of the time, or there is anhedonia or loss of pleasure or enjoyment of things that you usually enjoy, and some people would actually sign their daily plans or plans, suicide or attempts. There's disturbances in appetite, sleeping, restlessness, etc. Now you mentioned about grief. There are people who grieve after experiencing loss, but it doesn't necessarily mean that we are depressed. Because there's differences in grieving and depressed. When we grieve, for example, someone died and then we're grieving, the feelings of sadness are usually centered around the person that was lost. However, in depression, the sadness is usually centered around feelings of worthlessness. So it centers around itself rather than in a relationship or the loss of a particular person or an object. So it's different. One does not necessarily.
So just on one side, when we talk about depression, so what makes it a psychological disorder?
Well, as we mentioned earlier, apparently being depressed can be a normal thing. It's actually not normal. A person doesn't feel sad. But it becomes a problem when it impairs functioning of the person. It's again things that the person usually does. He or she is alone now, clearly is a feelings because of the experience of depression. So if the experience of depression affects the work of the person or the studies, then it becomes a problem.
As you mentioned a while ago, you said we all feel grief or sadness, but you said that doesn't necessarily mean as depression. But can it lead to depression or grief?
Yeah, it can. Kasi it's actually if you look at it, it's like a continuum. So it becomes clinical depression if there are many symptoms, and if the symptoms persist for a period of time. Because most of us can experience a depressed mood, but after a day or 2 days, it comes up or you're again shaking off. But for those who have depression, it's prolonged. So usually 2 weeks or more. What was the other question?
What are the chances that this normal grief, if we can lead to depression?
Well,
if there are many life stressors facing the person, or if the person is already, there's a certain type of personality. So if the person has a depressive type of personality, it could lead to clinical depression. And also if the social support system is not very strong, it could also